This medication, Xtampza Er, is used to help relieve severe ongoing pain, such as due to cancer. It belongs to a class of drugs known as opioid analgesics and works in the brain to change how your body feels and responds to pain. Higher doses of this drug should only be used if you have been regularly taking moderate to large amounts of an opioid medication. It's important to note that these higher doses may cause overdose, even death, if taken by a person who has not been regularly taking opioids. It's also important to know that the extended-release form of oxycodone should not be used to relieve mild pain or pain that will go away in a few days. This medication is not for occasional, as-needed, use. Remember to always consult the medication guide provided by your pharmacist before taking Xtampza Er. Take this medication on a regular schedule as directed by your doctor, not as needed for sudden pain. Take it with food, usually every 12 hours. Swallow the capsules whole, and if you have trouble swallowing them, you can sprinkle the contents on a spoonful of soft food or directly into your mouth. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. The dosage is based on your medical condition and response to treatment, so do not increase your dose or use this drug more often or for longer than prescribed. Before starting this medication, ask your doctor or pharmacist if you should stop or change how you use your other opioid medications. Suddenly stopping this medication may cause withdrawal, so your doctor may lower your dose slowly. If this medication stops working well, talk with your doctor. And remember, take this medication exactly as prescribed to lower the risk of addiction. As with all medications, Xtampza Er may cause some side effects. These can include nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness. However, many people find that these side effects lessen over time. If you experience any of these side effects and they persist or worsen, it's important to talk to your doctor or pharmacist. To help prevent constipation, it's recommended to eat a diet high in fiber, drink plenty of water, and get regular exercise. You may also need to take a laxative, so be sure to ask your pharmacist for advice on the right type for you. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when moving from a sitting or lying position. Remember, your doctor has prescribed this medication because they believe that the benefits to you outweigh the potential risks. However, it's important to be aware of any serious side effects. These can include interrupted breathing during sleep, mental or mood changes, severe stomach or abdominal pain, difficulty urinating, and signs of your adrenal glands not working properly. In rare cases, a very serious allergic reaction could occur. If you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. And as always, if you have any concerns about the side effects of Xtampza Er, don't hesitate to discuss them with your healthcare provider. Xtampza Er contains oxycodone, which has a risk for abuse and addiction, and can lead to overdose and death. It may also cause severe breathing problems. Your doctor should prescribe the smallest effective dose for the shortest possible time to lower these risks. It's important to talk to your doctor or pharmacist about having naloxone available to treat opioid overdose, and to teach your family about the signs of an opioid overdose and how to treat it. The risk for severe breathing problems is higher when starting this medication or after a dosage increase. Taking Xtampza Er with alcohol or other drugs that cause drowsiness or breathing problems can have serious side effects, including death. It's important to know how to take Xtampza Er and what other drugs to avoid. Seek medical help right away if you experience slow or shallow breathing, severe drowsiness, or difficulty waking up. Keep this medication in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, seek medical help immediately. Women of childbearing age should talk to their doctor about the risks and benefits before using Xtampza Er. Tell your doctor if you are pregnant or planning to become pregnant. Using Xtampza Er during pregnancy may slightly increase the risk of birth defects, especially in the first 2 months. Using it for a long time or in high doses near the expected delivery date may harm the unborn baby. If used for a long time, babies born to mothers who use this drug may develop severe withdrawal symptoms. Tell the doctor right away if you notice any symptoms in your newborn baby. Before taking Xtampza Er, make sure to inform your doctor or pharmacist about any allergies you have to oxycodone or other opioid pain relievers. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor or pharmacist before using Xtampza Er, especially if you have any brain disorders, breathing problems, gallbladder disease, kidney disease, liver disease, mental/mood disorders, or a history of substance use disorder. This drug can cause dizziness or drowsiness, so it's best to avoid alcohol and marijuana while taking it. If you are an older adult, you may be more sensitive to the side effects of Xtampza Er, so be cautious of confusion, dizziness, drowsiness, and slow/shallow breathing. If you are pregnant or breastfeeding, consult with your doctor before using Xtampza Er, as it may harm an unborn baby and can pass into breast milk. When taking Xtampza Er, it's important to be aware of potential drug interactions. This includes other pain medications, HIV medications, certain antibiotics, and drugs used to treat seizures. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be cautious when taking this medication with other products that may cause drowsiness or breathing problems, such as alcohol, marijuana, or muscle relaxants. Xtampza Er may also interfere with certain lab tests, so make sure your healthcare providers are aware that you are taking this medication. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Xtampza Er and is experiencing severe symptoms such as passing out or difficulty breathing, administer naloxone if it is accessible and then call 911 immediately. If the person is conscious and not showing any symptoms, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, a slow heartbeat, or slipping into a coma. It is important to seek medical assistance immediately in case of an overdose. This medication is prescribed for your specific condition and should not be shared with others. It should only be used for the condition it was prescribed for and not for any other condition without your doctor's guidance. If you need to treat a different condition, a different medication may be needed. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just wait and take the next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to store Xtampza Er at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it's no longer needed or has expired, be sure to properly discard it. You can find more information in the medication guide or by consulting your pharmacist or local waste disposal company. Remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.